to the Combat Zone podcast. I'm your co-host, Joseph Ben-Ami, and sitting across from me is Nick Vandergraat. Cue Nick.
Where the enemy's only battle cry is abandon ship, bail out, and take cover.
And do we have a lot of stuff to talk about today? We have far too many things to talk about today. There's no end to the subjects that we could be addressing and shooting at. Figuratively, not literally. Although I have to tell you, in Nick's case, a little literally too. Let's call this the Ontario budget edition of the Combat Zone podcast. But before we get into the Ontario budget, and by the way, before people click off and go, "Oh, I'm not from Ontario, I don't want to talk about the Ontario," listen to talk about the Ontario budget. We're going to get into it talking about a few philosophical things that really apply, I think, to
budgets in general,
government budgets in general, not just Ontario. So, and what we'll do is we'll use Ontario and the current Liberal government as the whipping boy, or in this case, the whipping girl,
with a punching bag. Call it what you want.
And we probably could become a little bit more politically incorrect, but we won't go there.
Like we worry about that.
Right.
Yeah, there's all kinds of things. And it's from a philosophical point of view because, you could take the Ontario budget and tear it apart piece by piece. But it's not so much the fact that any one program is spending X amount of money on that particular program. It's the idea about having budgets and having deficits and debt and that kind of thing in general that apply to governments no matter where you are. That I think is really what we're driving at.
Right. So before we launch into the budget, I just want to tell people this neat little anecdote about guns and shooting and Nick Vandergraat. We're working on this project together, and we happen to be on a conference call, and this is going back a few years, and he knows where I'm going with this. That's why he's laughing, right?
Yep.
So we're all having a serious discussion about some financial plans, etc., and all of a sudden we hear these bang, bang, like sounded like gunshots in the background. So the guy one of the guys that we're on the call with says, "What the heck is that?" And it turns out it actually was gunshots. Nick was over in the back of his property and shooting at what were you shooting at, Nick?
Well, what was going on was I had my .22 and I was down by the pond and had to take some beavers out because beavers are very destructive little critters. And if you don't manage the numbers, they do a lot of damage, and it was flooding my neighbor's hayfield.
And by the way, just an interruption. We believe in straight talk here, so I just want to make sure that everybody understands that taking beavers out is a euphemism for killing them.
Yes, no doubt about it. I was having a high-speed conversation with my beavers using little pieces of lead, and I was throwing, they were catching. So that spells killing them. And I don't have any problem shooting wild animals. Anyway, so...
By the way, and... talking about throwing and catching, just for future reference, we're going to do a podcast on the Ontario curriculum in the not too distant future, and you guys have to stay tuned for that because there's some amazing information about how you teach in health classes and physical education, throwing and catching,
and jumping,
playing catch and jumping, etc. So
yes,
and I'm just telling you guys. When we do this, you have to listen to it, and you're not going to believe that we're not making it up. So,
we have the document right here in the building, and when we do it, we'll be reading right from the document itself.
Yeah. So there's the teaser. So yesterday was Budget Day in Ontario.
Well, let me finish telling the story first.
Oh, sorry. Yeah. Okay. Go ahead. Quick.
So anyway, I have my Bluetooth in. And I'm listening in on this telephone conversation, and I warned everybody. I said, "Look, guys. If you hear a shot, don't worry about it. It's just me down at the pond, and I wasn't using any heavy caliber weapon. It's just a .22. But when it's right next to your ear, when you pull the trigger. So our friend George went, "Whoa, my God, what was that?" I said, "I warned you. I'm out here shooting at beavers." He didn't think I was serious. And it was a lot of fun. We had a lot of fun over that. And the beaver had a rough day, but that's okay.
Okay.
That's the story.
Rest in peace. Rest in peace.
Rest in pieces.
Rest in pieces, Nick's beavers. We're going to have to do a show on guns and hunting pretty soon,
Absolutely.
Which is going to work out pretty good given the fact that we are the combat zone.
That's right.
Okay, so yesterday, getting back to seriousness here. Yesterday was Budget Day in Ontario, and no surprises. The current Liberal government in Ontario brought down a budget that, again, is in a deficit position, somewhere north of $8 billion a year. They're projecting in deficits, and that will increase, I think, the debt for Ontario to somewhere, you were mentioning it this morning, I should have checked the figures, but
the latest numbers I saw before this deficit budget was the provincial debt was around $315 billion.
315. So this will push it up over a 4-year term. If in fact the Liberals win and they implement this budget, this would push the debt up in Ontario to somewhere in the order of $360,000 when you start to factor in interest, etc. So it's a real problem, and we just want to talk about about the budget and some of the spending ideas, but I want to talk about them more in terms of generalities, and because I think that the principles that we are looking for, that we would apply to our analysis of the budget, are generic principles that apply equally whether we're in Canada or the United States, whatever province we're in, whether state we're in, or in Europe, or indeed any government. That governments have to operate in a fiscally responsible manner. And Nick, I don't know about you. I know people who are opposed to deficit spending in all cases. There's always talk about there's always talk about passing balanced budget legislation.
Right.
There's talk from time to time in the United States about having some kind of a balanced budget amendment to the Constitution. But more legislatively than constitutionally. Here in Canada, we don't talk about it constitutionally. We talk about it just in the legislative sense. And I'm not opposed to deficit spending. I'm not opposed to the idea of borrowing money when the circumstances require it. If there's a crisis, if there's an emergency situation, the idea that we borrowed a lot of money fighting World War II. Right. I don't think that was a bad thing. What I object to is the idea of constantly borrowing money. That it's as though it's just a hole that nobody cares about whether we're going to actually be able to pay that money back. And in fact, why should people today care about whether that money is going to be paid back by them? Because it clearly is not going to be paid back by them. It's a debt that we're shouldering our children and our grandchildren with, and our great-grandchildren potentially. So we're going to get into that a little bit as well. But let me just back up a little bit, and let's talk a little bit about some of the programs. There's a lot in this budget, and one of the things that I think is probably a few of the things that I think are some of the most egregious aspects of it are the idea of free daycare, okay, and we can take that apart, free pharmacare, which is an interesting way of saying you don't even have to pay for your prescription drugs anymore. So I don't know. First of all, is it just me, or is the population, is the general public just not able to process this language, this idea that these things are free?
Well, I think a lot of it comes. Let's take the pharmacare. Who qualifies for it? This is a straw dog, first of all, because who qualifies? People under 25. Most people under 25, generally speaking, are in excellent health. They don't need to go to the pharmacy for anything more than, birth control. Other than that, they might go get vitamins, but they're not on prescription drug plans like somebody with diabetes would be, who's in his mid-50s. Okay, there's nothing for them. There's nothing where it would really matter if you were going to do this. The group that you would want to do it for gets no attention at all. If you really cared, if it was about compassion, then they would go to the people who are elderly, who have huge bills to pay that are causing them, from a prescription point of view, because prescriptions aren't cheap. I mean, I'm not saying, and I'm not for this pharmacare idea. I'm just saying if you were going to do this, targeting people 25 and under makes no sense, because other than just window dressing, and I want to get elected again, so I'm going to make it seem like I'm compassionate because I know in the end it's not going to cost me anything financially. Then you look at the other program about the one about
daycare.
what's that? Daycare. Okay, daycare. Well, the reason why so many people like daycare is because they think it's free. They haven't for some reason, and I think it starts out in they don't teach in school how the government raises money, where that money comes from, what taxation is. They don't do much in Civics 101, that's for sure. So they simply, the best you might get is how a law gets passed. And other than that, what do people know about taxation? You know, they don't understand that it comes right off your paycheck. So you're not paying for it when you walk into the daycare center. You've already paid for it, and it's being administered by people with no skin in the game. So they don't care what it costs. Dinesh D'Souza did a great example. He said, look, if you could go to the grocery store and you knew that somebody else was paying and you could just help yourself, what kind of grocery cart would you need? You'd fill your cart to the top every single time because you're not footing the bill. Somebody else is, right? And would the grocer care whether a quart of milk is $10 or $1? He's not going to care either because he knows he's going to get paid no matter what. And this is one of the reasons why government-run things like this are always more expensive, are always less efficient. And I know, efficiency and government don't fit well in the same sentence. But I think that's really what's at the root of this.
It's interesting that you talk about the grocery cart and whether you're paying it or not, because really that's actually, it's economics 101. Mm-hmm. If you don't have some relationship between the consumer and the cost of their consumption, then the demand just skyrockets, and the supply can't keep up with the demand, and as a consequence, the prices rise. Now, the reason I'm bringing that up right now is not because I want to give a lesson in basic economics. It's because I want to illustrate the actual problem with our healthcare system, because we know that healthcare spending is out of control, and this budget increases healthcare spending. I didn't write down the exact number, but it increases healthcare spending, and there's this notion that the only way that we can control the cost of healthcare is by controlling the amount of money that we're spending on it, that we're charging for different items, and then what we do is we remove, as I say, the cost of the consumption, the consumer, because patients are consumers of healthcare. Healthcare is the product, so let's not beat around the bush with that. So we remove the cost of the healthcare, the cost of the consumption from the consumer, and that's what drives prices up. So in my roundabout way, what I'm getting at here is that the number one driver of an out-of-control healthcare budget is, in fact, our attempt to control the healthcare budget. And if there was some way that we could introduce some kind of relationship or reintroduce some kind of a relationship between healthcare consumption and the cost, okay, then I think that you would see that the cost would go down, and not just that. So I have a few practical suggestions around that, but not just the cost of healthcare would come under greater control, because people would be a little bit more circumspect about accessing the healthcare system for relatively trivial reasons, and that would reduce, I believe, the number of the amount of time that people wait in waiting rooms, in emergency waiting rooms, particularly because the waiting rooms in emergency hospitals are populated largely by very trivial cases, which are not, in fact, emergencies. Here's a really beautiful example. Okay, we deal with a healthcare provider. It's like a clinic. Our doctor works at a clinic. Many of us, that's the arrangement that we have now. And when you call the clinic to make an appointment with the doctor, what they'll tell you is, if this is an emergency, call 911. Okay, we all understand that. But then what they'll say is, and this is supposed to be an urgent care clinic, then what they'll say is, if this is after hours, go to your local emergency. And I'm going, okay, well, that's a significant contributor to the problem. So we think that if we just throw more money at the healthcare system, if we have more money spent on emergency care that it's going to solve the problem. But it's really not going to solve the problem because the population continues to increase. And I say, there's nothing there to, I hate to use the word discourage, but there's nothing there to encourage people to maybe just hold off before you go to the doctor for a cold, or you have a splinter. Maybe you remove the splinter yourself. I mean, when I grew up, people were not dying in the streets because they weren't rushing off to the emergency ward every time there was a problem.
Well, I think you have it, and especially with young families, when they have their first child, if that child gets a sniffle, emergency room. If it has an earache, emergency room. And I'm not putting down young couples and families and things like that. That's not the point. But because they don't have, either they grew up in a single-family home or they never were around a family where there wasn't access like you were referring to, they don't know what's important to take to the doctor, and they don't know what isn't. Now, my dad had a very simple philosophy, and I don't know that I necessarily agree with it 100%, but he said, unless there's arterial bleeding or bone sticking out, you're not going to the hospital. Okay, well, there's a lot of conditions that you'd go to the hospital for that don't fit that. But the general idea was, unless you're really hurt, unless there's a real emergency, it can wait. And that was the point he was trying to make. His use of analogy was probably a little crude and not really, perfect. But the idea is, look, if you've got a splinter, if you've got a blister, if you've got, something. Now, if you get a kidney stone, you're going to the emergency. Trust me, I've been there a couple times. The last thing you want to do is live through that. But anyway, there's a lot of conditions out there or situations that arise in daily life that people go to the emergency room for. I'm not feeling well. I have a headache. I've got a fever. Okay, well, unless it's, and maybe if you don't know what the cause is, but if you're just not feeling well, don't go to emergency. Take some aspirin, go to bed. See what you feel like in the morning. If you're still not feeling well, book appointment with your doctor.
Right.
Don't clutter the emergency room when there's people out there with broken limbs, heart attacks, serious conditions that need attention right away.
Right. Yeah. I was thinking the other day that, you remember, we're old enough, you and I, Nick, that we remember wage and price controls. That experiment lasted, I don't recall exactly how long it was, but it was not a very long
It was
experiment.
mercifully short.
And so we all know that wage and price controls don't work to control inflation, except somehow or other we have this notion that wage and price controls inflation in individual industries like the healthcare industry. And that is the way we have it in healthcare in this province. We have wage and price controls. The government decides what the prices are, and the government decides what the wages are that they're going to be paid, and then to compound the problem, of course, while this is happening, and they do this to control the prices, to control the costs, because the costs keep growing out of control, and the number one reason why the costs keep growing out of control is the wage and price controls, coupled with the fact, as I say, that there's no connection between the consumer and the cost of consumption. So even if you had just a modest fee on a sliding scale, I'm not talking about full-blown 100% pay out of your own pocket healthcare, okay? I'm just talking about a few adjustments here and there where we still keep the principle of having, access to healthcare for all people, affordable healthcare for all people. So introduce some kind of a user fee on a sliding scale. So it's whatever your user fee is based on income. And of course, you have today, everybody has their health card in Ontario. I'm speaking about Ontario now, but it's not technologically difficult. I'm thinking about the boondoggles around creating these.
I was just going to say, be careful what you're talking about.
It shouldn't be. Let me rephrase that. It shouldn't be technologically challenging for the government to implement something like this. But when you pay. You go with your health card. You give them your health card, and based on the health card, because health cards can be programmed this way. It's like credit cards or anything else like this. You can have some kind of a code that determines what your fee is, and you pay that fee. So maybe the fee is just $5 per visit.
Right.
But even that $5, if you're talking about people, $5 is $5. So maybe you'll think, well, maybe instead of going to emergency, waiting 5 hours and paying $5 or $50 or whatever it is, maybe I'll just stay at home and see if I feel better in the morning.
Yeah, and I think that I might even carry that a step further and allow people to decide how much free health care they want to access and deduct. The way I would approach this is by saying, okay, the government can cover you completely if you want, okay? But if you want a reduction in your taxes equal to 5 or 10 or 20%, then we won't cover you. We won't give you 100% coverage because you can afford to pay for your own health care.
Right.
And that might be the kind of sliding scale you're talking about. So, in other words, if you take that $900 that McGinty took out of our pockets years ago, you could buy quite a health care package for that $900 a year and cover yourself rather nicely. But I want the reduction in my taxes because now I'm not a burden on the public health care system. I'm not using it at all, and I'm funding my own health care.
Let's stay on health care for a minute. I know we wanted to talk more generically about the budget, and we'll get back to a few things with the budget in a moment. But just on the health care thing, I think another thing that troubles me really quite a bit with the whole health care debate is the fact that there seems to be this inability of people to separate the insurance or the payment aspect of a healthcare system from the ownership and operation. And this, frankly, I just cannot fathom. I cannot fathom why you have to own, why the state, the government, has to own and operate the healthcare system, particularly hospitals, but in addition to having the universal insurance. And it seems to me that if we allowed private hospitals, or if we simply privatized the hospital system, we could maintain the insurance system exactly the way it is. Not that I'm advocating no changes to the insurance system, but I don't see the automatic connection between the two, except this ideological, this mindset that if the government is running the insurance and we want to keep the costs under control, we better own the hospitals. Here's the problem with that, though. First of all, just as a general comment, I just don't accept that the government is any better at running hospitals than it would be at running car manufacturing factories. I just don't see the connection between government and owning the hospital. That's the first thing. So that's more of a philosophical thing. But on the practical level, and you and I, we travel, and you used to drive a big rig, and throughout the United States, so you know what it's like. Spending a lot of time on the road down there, and I spend a fair amount of time in the States as well. I have children and grandchildren there, and I do some business down there. So one of the things that strikes me as peculiar or interesting about traveling in the United States is the plethora of advertisements for hospitals. In other words, if you have a heart condition, this is the best place to get it treated.
Go to Johns Hopkins, yeah.
And but not just Johns Hopkins.
That's just an example, yeah.
As an example, yeah, perfectly. So you go down and they're advertising, and the reason for that is, you see, here in Canada, when the state owns the hospital, and so it's simply a budget line item. This is how much the hospital costs to run, and this is the amount of money we allocate to that hospital. And every patient that walks in the door and is treated actually is a drain on that budget. Okay, so when a patient walks in the door in a hospital here, the way that the system is set up, it's actually that patient is actually a loss to the hospital. Okay, but in the United States, you want patients because patients are your revenue source. So in a private system, and again, understand, I'm not talking here about privatized insurance. Okay, let's just take that off the table for a second and just talk about the ownership and operation of the hospitals. So if it was a private system that way, then every patient that walks in the door is actually not a drain on your revenue, but is actually an asset. So you want those patients to come in the door, and you are going to do everything in your power to ensure that the experience that they have when they walk in the door, from the emergency room, if that's where they're coming,
yep.
to getting wheeled out,
yep.
no matter how healthy they are in a wheelchair, okay, and given a pat on the back and say, listen, keep us in mind for your next healthcare crisis, okay? They do everything in their power to make the experience for patients comfortable, efficient, okay, and because they want to have that reputation. So it just seems to me, again, that if you really want healthcare reform, if you really want to get healthcare under control, and there's a lot of things that have to be done, there are a lot of problems, okay, so this is not a panacea, it's not a silver bullet, but it just seems to me that that's the most logical first step, is now, sell the damn hospitals. And you know what? If you want to have a community of 5,000 people with 5 hospitals, if they can make a go of that, let them do it. Well,
Pembroke used to have 4. So it's not that they, when the state takes over, things get worse, in a nutshell. But from a realistic point of view, as much as I love that idea, there is one huge fly in that ointment, and that's called unions. And if you're going to sell a hospital and turn it over to private hands, you are going to have the fight of your life on your hands, because the public union who work in hospitals are just going to have a cow. That doesn't mean it shouldn't be done, but let's recognize that, nobody's sitting here. I don't think you and I are under any illusions that A, it's going to happen tomorrow, and B, it would be a very easy thing to do in the first place. As you alluded to, there's a lot of problems. I think this is one of the biggest one, is overcoming resistance by union members, because they're a large voting bloc, and you have to get past them in order to get this done. Even if, in the long run, it would be to their benefit. They'd work in a better environment. They might make even more money, all kinds of different things. They might have a better benefits package, although how you get a better benefits package that some of the public sector unions have, I have no idea. But I'm just saying that these guys, in the long run, they might be better off in a private setting. So who knows? But in principle, I don't have any problem with taking something the government does, whether it's healthcare or anything else. You want to talk infrastructure, okay? Turning that over. And somebody made a point to me the other day about triple P relationships, private-public partnerships. Almost everything we do is a public-private partnership. And I know people go, oh, my God, we can't let the private sector. Who builds airports? Does the government have a steam shovel and they go out there and flatten the ground and put down the runway?
Yeah, don't give them any ideas.
I know. I'm just saying. But realistic, same thing with building roads or bridges, unless it's the bridge at Nipigon, which the government cut the ribbon on in a year ago last October. And then in January, the thing heaved by over a foot and they had to shut it down and drive through Minnesota to get out west. Okay, don't let liberals build you a bridge. Bad idea. Anyway, but the point I'm making is that everything the government does is a public-private partnership, because it does not have the capacity or the technical ability to actually get it done. Those days have so far in the past, it's not even funny. And yet we still hear this fear that comes from the public unions about how terrible it would be if we actually let the private sector do anything.
It's clear that we're going to have to do a Episode-002 on the budget, because we haven't really gotten that to.
Are we out of time again?
No, we're not out of time, but time is getting short.
Okay.
Listen, I really, really want to talk about the debt. Okay. I want to talk about debt in general, because I just don't think that people really appreciate how serious the problem is. First of all, in Canada, last week we hit a market value $1 trillion of federal debt.
Unbelievable.
$1 trillion of federal debt in market value, and that's a huge problem. And just to put that in perspective, okay, the Americans, what do they have? 350 million people population.
Yeah,
so it's about 10, a factor of 10. So I guess that would be somewhere in the order of $10 trillion for us. So I don't know, what is the national debt in the United States? Maybe somebody can send us an email to that effect. We'll give you the address at the end of the show. But it's the numbers aren't what's important here, okay? The numbers are not what's important. As I said, I don't have a problem with deficit financing. I don't have a real problem philosophically with the government having debt. I know other people do. In the short term. But it's like I hear all the time people saying, oh, it's like having a mortgage. I hear politicians say this. It's like having a mortgage, okay? You borrow the money, you pay the mortgage. It's not like having a mortgage, Because with a mortgage, you borrow the money, you have to have a plan to pay it back. If you don't have a viable plan to pay it back,
you're not getting it.
You're not getting the mortgage in the first place, okay? Right. But once you have the mortgage, you have to pay it back. And people do. They pay it back, and at the end of a period of time, the mortgage is paid, and you live mortgage-free. Now, that's maybe not such a normal thing these days, because lots of people are borrowing
far more than they can pay
equity
back.
Against, they're refinancing their properties so that they have access to the equity. So they end up being 65, 70, 80 years old, and all of a sudden they have this massive debt, mortgage payments that they have to pay. But it's not, the point I'm making is that the way the mortgage system is supposed to work is you borrow the money, you purchase the property, you pay the mortgage off, the property is yours outright. Except, of course, for all of the regulations around it these days and the taxes you pay on it, but that's a separate subject altogether. So it's not like having a mortgage. It's an ongoing growing debt, and if it's not at crisis levels now, it soon will be. And the two big problems with the debt are, first of all, the bigger the debt, the more money that we spend in our current budget servicing that debt. In other words, if you are, let's say the debt is not the debt, but let's say that your interest payments, or you're paying 20% of your current budget servicing the existing debt. That means that you, as a taxpayer, are only getting 80 cents worth of service on the dollar of tax that you're paying, because everything else is going to servicing the debt.
Right.
So you're not getting full value for your tax dollars. And the problem is growing and growing. So, in fact, what ends up happening is you end up crowding out essential programs where the debt servicing charges are actually more than you would be paying on some of the essential services that you want to pay for. But here's, to me, this is the real philosophical problem. And, we've sort of gone through towards our general 30-minute target. So I guess it's important that I actually make this point. One of the fundamental principles, if not the fundamental principle, of democratic government is no taxation without representation. Because the only way that you can control, when the Crown, here in Canada we have the Crown, or the government, the executive of the government, whether it's in the Crown or it's directly elected or whatever, like in the United States, the only way that you, the people, have to control these people is the power of the purse. Yep. And that is a fundamental principle of democratic government, is no taxation without representation. It's the legislative branch, the representative branch, the people's representatives that control the money. And if the executive wants to do things that the people don't want to fund, that should be the end of it. The people that are going to pay these bills on their taxes are not even born yet.
Yeah, so how can they be represented?
So they don't have any representation. So for me, the idea of this ongoing chronic deficit financing habit that we have, and by the way, let me just take an aside and say, this is a dragon that we slew in the 1980s, and I'm just astonished that, it's come back with such a vengeance. But this notion that we can have continue to grow the debt, and we don't have to worry because, well, as I think John Maynard Keynes said, in the end we're all dead. He said it tongue-in-cheek, but he's right. Except that we leave the bill to our children and our grandchildren, our great-grandchildren, and future generations that aren't even born yet. So to me, this idea of this chronic deficit financing and this growing debt is a violation of that fundamental principle of no taxation without representation. And I think I think that that's fundamentally immoral. And that's why I think social conservatives in particular, and I know you are, and so am I, ought to be far more concerned about the debt and the deficit than we generally pay attention to.
Yeah, I think it's just a lack of understanding basic economics. Like, you know what? We don't have an income problem in this country. We have an outgo problem. And that people have to understand that it doesn't matter how much you take in if you're always spending more. sooner or later that cow's going to come home and the chickens are going to come home. You use whatever analogy you want, but that bill must be paid, or at least you have to. It's like a credit card debt. If you're always making the minimum payments, you're not getting ahead just because all you're doing is making the very minimum payments. Take you 30 years to pay off a balance on a modest credit card.
It's even worse than that, because in fact, even though we may be making minimum payments every month, there's no credit limit.
Yeah, well, that is true. It's like,
so our spending is actually more than the payment we're making. So the balance on the card keeps going up and up and up and up and up, and we never make a dent in the balance. And the debt charges and our payments go up, but only because the debt charges are going up.
Yeah, it is mind-boggling about how many people just can't seem to get their heads around that and understand that. Look, I know it's not sexy. There's nothing sexy about finances. People hate it. They don't want to talk about it in their private lives. And now when it comes to public life, they don't want to deal. They want somebody else to deal with it. But the fact is, as a citizen of this country, it is your moral obligation to hold your politicians accountable for how they're spending your money. And if you don't be surprised if they're loose with it.
Right. And this is a very serious moral problem, I think, just generally. It's not, there are economic arguments, there are, financial arguments, there are political arguments. But for me, if you strip away all of those things, this comes down to a basic question of morality. Is it right for you and I and the rest of us in this generation or the past generation, is it right for us to continue to live beyond our means? Because that's what we're doing. All of this stuff is nice, but the idea we're going to have free daycare now or free pharmacare, look, they're not bad in and of themselves. We could critique those, and maybe we'll do that in the next episode on their own merit. But whether they're good or bad, we can't afford them. We're living beyond our means, and we're mortgaging our children's future and our grandchildren, our great-grandchildren. To me, that is deeply immoral as a society. Yeah, it's I'm pro-life. We talk about abortion. I'm against euthanasia. I believe that we should do more to protect our children from harmful drugs. I believe that we should be doing more to protect our children and society from the harm of unrestricted, readily available pornography. There are lots of these things that we could argue on a moral basis. But to me, as a society, the most immoral thing that we're doing right now is we're saddling our children, our grandchildren, future generations with a debt, with these bills over which they had no say whatsoever in the accruement of.
Yeah, and I couldn't agree with you more. And part of that problem also comes from a society that says, well, who cares as long as the bank gives me the money? A lot of people are living exactly the way the government's funding itself. They're living beyond their means. They're taking out debt they can't repay. They're living on their credit cards to buy groceries, yada, yada, yada. So when they see the government doing similar things, they don't see it's a big deal.
And the irony of all of this is that the people who are driving this ideologically are the very people that are going to criticize small c conservatives, fiscal conservatives, for being materialistic.
Oh.
Okay?
Austerity never works.
I'm saying, yeah, but I can't think of anything more materialistic than continuing to have all of these freebies, okay, living beyond your means, and saddling your children with the debt.
All because you want to make your life a little more comfortable.
So when people talk about how, we have to be less materialistic and, greed is bad and all that stuff.
What they're saying is
They're frauds. It's fraudulent. They're liars. They're fooling themselves.
What they really mean is you need to live that way. Don't look at me. I'm fine. But you need to live that way because it's easier to go after somebody else for their lifestyle than it is to deal with your own.
Okay, we've gone way over time, but that's okay because we just post these podcasts online, and we're not worried about we don't want to go 2 hours or anything like that. But anyway, comments.
Just when it comes to deficit spending and all that kind of thing, you're absolutely right about how immoral it is, and we need to get people to understand that it's not an income problem, it's an outgo problem. We have to control spending. We have to bring down, even if we never pay it off, every $1 billion that we pay off on our deficit frees up all kinds of money for other things. So even though it might take us 100 years to pay off the debt, if every government worked on it, the principle of trying to pay it off is where the reward is. And I think that's the only way to look ahead, the only way we're ever going to get out of this mess.
Okay, if you want to attack Nick Vandergrat for shooting beavers in his pond, send us your comments. The email address is comments@thecombatzone.ca. That's comments@thecombatzone.ca. And, feel free to be as critical as you want, because those poor beavers need your defense.
Well, there's not that many left.
Yeah, and while you're at it, if you have any comments about anything that we're talking about, you think we're off base in that, tell us. Call us, whatever names you want to. We have a beep mechanism if we read out your emails on the podcast. It's not a problem. Nick, we're having too much fun again.
Yeah, we are. That's the whole point of this. Half the point of this show is just to have some fun poking holes in how should we call it, the modern view of the world.
Okay, and we're still finding our sea legs here. So, guys, bear with us. We got into a lot of detail, got into the weeds a little bit, but I think it's still good. I think that the stuff we covered was good today. But clearly, we're going to have to do another half-hour segment or more on the budget itself and some of the programs in it. So, unless you have anything else to add to that, Nick, I guess we'll sign off till next time.
All right. In that case, we'll see you all again next time.